Well, hello everybody, wherever you are in the world, and thank you very much indeed for joining us at this Global Action on Men's Health, No Man is an Island, Race to End HPV webinar, looking at the lived experience of men with a cancer caused by HPV. You're all very welcome indeed. Before we go any further, just a few housekeeping notes. Um, Please sign in using the chat. It'd be great to know who you are and what organisation you're from. And please use the chat to ask any questions, make comments, share thoughts, etc. We'd love to have you actively participating in this event. This will be an interactive webinar, so we'll take questions and comments after the speakers have made their presentation. So please do take part. This webinar is being recorded and it will be posted on the Global Action website and YouTube channel as soon as we can make that happen. And this webinar will last 60 minutes. We're dedicating this webinar to the memory of our dear colleague, Jamie Ray, who sadly died in May at the very premature age of 60. Jamie was diagnosed with a throat cancer caused by HPV about 15 years ago, and frustrated and angry at the treatment he received, he set up a charity called the Throat Cancer Foundation, which was based in Scotland, but worked across the UK to support patients and their families. He was also very instrumental in creating and supporting HPV Action, a coalition of organisations in the UK which worked to persuade the government to extend HPV vaccination to boys. It took HPV Action 5 years to achieve its goal, and boys have been vaccinated in the UK since 2019. But without Jamie's generous, steadfast and astute advice, guidance and support, HPV Action almost certainly wouldn't have succeeded. Jamie will be very sadly missed by everyone who knew him as a friend and colleague in the UK and beyond. So thank you for that. Next slide, please. Okay, so I'm Peter Baker. I'm Director of Global Action on Men's Health, and I'll be chairing today's webinar. And shortly I'll be handing over to my colleague, David Winterflood, who's Director of No Man is an Island, Race to End HPV. He will say a few words before we hear from our other speakers, who I'll briefly introduce now. First up, we'll have Patrick Howard, who will talk about surviving penile cancer. Patrick, like me, is based in the UK. And then we'll move over to the United States, where Jason Mendelsohn will talk about his experience of an HPV-related tonsil cancer. And we're hoping to hear from Samuel Zawada, who is joining us, or hopefully will join us, from South Africa, who will talk about his experience as a widower due to cervical cancer. But unfortunately, Samuel's been in touch to say that there are internet issues in his area in South Africa. So we hope to hear from him, but we may not. But we'll keep you posted as to what happens there. And then we'll hear from Kevin Case, who will talk about his experience from anal cancer. And Kevin, like Jason, is based in the United States. So I'll stop there and hand over to David, who will explain why we're hosting this webinar today. Over to you, David.
Thanks, Peter. Hello, everyone. Thank you for joining us. Why this webinar? Well, we have the means to protect everyone against HPV, whatever their sex or gender. And to achieve this, No Man and Global Action on Men's Health have united to attain a more ambitious, ethical and equitable approach to HPV vaccination at the global level. And as we say there, we believe that the approach to preventing diseases, infections and cancers caused by the virus, the approaches need to include expanding HPV vaccination programs to protect boys as well as girls, particularly in low and middle income settings. So last year at the World Cancer Congress, we launched a case for action. If we can get the next slide, please. which has since been endorsed by over 50 organizations around the world supporting this approach. You can find out more via the website www.endhpvglobal.org. You can see some of the organizations that have endorsed that on the next slide. And today's webinar is our second in our global series. If we can get the next slide, please. Talking about the lived experience of males. And as we say that in the slide, at least 180,000 males a year are diagnosed with a cancer caused by human papillomavirus, but we rarely hear these personal stories. And we believe it helps to highlight that males as well as females are affected by human papillomavirus, and raising the voices of male survivors, well, it improves our understanding of their specific experiences and concerns. It supports better vaccination programs, treatment and care, research, evidence and advocacy. And sharing male stories like today, publicly, it can help challenge the stigma often associated with HPV cancers. In truth, we actually found it hard to find other males to speak on this webinar. We're very grateful to those who've joined us today, but the more that men speak out, the easier it will be for others and their partners to talk about their experience of HPV cancer. And in an age rather of increasing vaccine skepticism, hearing the testimony of males whose cancers could now be avoided through vaccination is really helpful to counter the narrative that it is the vaccines that are dangerous and not the diseases that they can prevent. So this webinar, it supports our call for global public health organizations to prioritize the elimination of all the cancers caused by human papillomavirus, and also consider boys together with girls as a primary target for vaccination. And as I said at the start, ultimately, a more ambitious, ethical, and equitable approach to HPV vaccination is needed to achieve the elimination of HPV cancers. So thank you again for joining us. I will just acknowledge that Global Act on Men's Health's work on men cancer and HPV is supported by an unrestricted educational grant from MSD and by No Man is an Island Race to End HPV. So with that, I'll hand back to Peter, who will be chairing this next section. Peter.
Thank you very much indeed, David, for presenting the background to this event so clearly. I'd now like to, without any further ado, go straight to our speakers. And first of all, I'd like to welcome Patrick Howard, who's joining us from Liverpool in the United Kingdom, so not too far from where I am. So Patrick, you're very welcome, and please tell us your story.
Thank you, Peter. Thank you, David, and welcome everyone. So this is my story. Bit of background about myself. I'm still here, very much alive and kicking, despite having had prostate cancer, which was diagnosed back in September 2017, penile cancer, which was diagnosed in September 2020, and for good measure, kidney cancer, which was discovered as part of the early days of the treatment for the penile cancer. Prostate cancer was dealt with by a single, I nearly said simpler, it probably is simple, operation to remove it, followed by a 3-month or so recovery period. Penile cancer has not been so easy to deal with, due in part to it being assessed as a particularly rare, aggressive and advanced form of the disease. And I vividly recall seeing the consultant who diagnosed it. It was in the middle of the COVID lockdown, and my wife and I were actually quite excited by the prospect of dressing neatly and actually leaving the house. The journey home, however, was far more sombre, having been told that my chances of survival were very slim indeed, and additionally that the treatment available had a far higher chance of killing me than curing me. We decided that however small the odds, we would go down the treatment route. In hindsight, I think that having a very short period of time between receiving the news and the operation itself meant that I couldn't give it too much thought, which was probably a good thing. So I can remember saying to my wife, well, whatever they do, at least they're not going to chop it off. How wrong I was. I had several operations, including the unimaginable eye-watering one, a partial penectomy, which was considered by the consultant as a minor operation. It wasn't how I considered the matter, I have to say. Following the penectomy, I had a number of other very lengthy operations, all of which had fairly extensive recovery periods. I contracted sepsis, which was decidedly unpleasant, and that very nearly carried me off. I then had an extensive course of radiotherapy, 5 days a week for 6 weeks. And this was followed by 6 months of high octane chemotherapy, which the consultant described to me as the kitchen sink of chemotherapy. And then more recently, I had another 6 months of even more high octane chemotherapy, which the same consultant described as the kitchen sink, fridge, couple of kitchen units and microwave of chemotherapy. So reassuring, I thought. Even throughout this journey, and despite being told many times that I had less than 12 months to live, I consider myself fortunate. I completed this treatment 18 months ago, and whilst I will never be cured, I'm currently doing okay, for which my enduring thanks and gratitude go to all the staff at the Christie Hospital in Manchester. Now, luckily for me, the prostate cancer was discovered by accident, and I will readily admit that I had been behaving like a typical man and had no particular desire to go to the doctor. I was very much of the mindset that there's nothing seriously wrong with me and hence no need to discuss it or trouble the doctor. This attitude changed somewhat when I experienced redness and itching on my penis, which I very quickly discussed with my wife, and I would have gone to the doctors immediately had it not been for COVID. Men desperately need to discuss any health issues or concerns with their partners as and when they arrive. Partners can provide the support and encouragement in engaging with the medical establishment and the subsequent journey through any treatment and recovery. And all too often, there's a tendency to think that the patient is the only one affected, but that is not the case. All the people close to the patient are equally affected. The impact on partners, children, and close family and friends is quite severe. I was extremely fortunate that when I saw my GP, despite her not having any specific male cancer diagnosis training, she instantly suspected penile cancer and referred me to a consultant. This is, in my opinion, an extremely important issue. The medical community must ensure that these male cancers are covered in GP training sufficiently, as they're all too often misdiagnosed, which wastes valuable time prior to treatment and results in far poorer outcomes. I am well aware that it is not easy for anyone to talk about cancer of any type, and it is particularly difficult to discuss cancer when it affects those more sensitive parts of the body, such as penile cancer, anal cancer, and testicular cancer. I find it is rather like a death in the family. Nobody in the room likes talking about it. No one wants to ask about it, how it feels, how my wife feels, what the surgical impact is, or how you're dealing with it emotionally. People just ask how you are, hope that you say okay, and then move the conversation on. So that's my story briefly, and the reason I tell it is because I believe it's a conversation that needs to be had. I had no idea that penile cancer was even a thing. Also, I thought HPV only affected young adults. The human papillomavirus, HPV, is an all too common link to many cancers, and many men's cancers in particular. This message needs to be amplified by telling the world that HPV and these male cancers exist and that they affect men and women equally, which is why we need to take and make sure the male conversation is as normal as breast cancer in women, and the HPV conversation is as normal as the flu. We need to talk about HPV and improve awareness that it is present in a huge percentage of the population, pretty much anyone who's kissed anyone, really. And we need to know about it and actively do all we can to encourage the gender neutral HPV vaccine rollout to boys and girls right across Europe and the world. Nowhere should be left untouched by the vaccine. As I've said before, it shouldn't be a moonshot, just a shot in the arm. Thank you very much.
Thank you very much indeed, Patrick. That was a fantastic introduction to today's webinar. And I love the good humour with which you told a very painful, obviously personally distressing story. We'll come on to many of the issues that you've raised later, but I just wanted to highlight at this point one thing you said about the importance of men presenting symptoms, red flag symptoms early to a GP to enable early diagnosis, which is a key issue in men's health generally. So thank you for making that point, along with everything else that you said. So thank you, Patrick. And can I turn now to Jason, who I think is, yes, he's there. I can see him and he's joining us from the States. So hi, Jason, and the floor is yours.
Thank you. Can you hear me okay?
Perfect.
Okay, good. Well, as they said, my name is Jason Mendelsohn. I am a survivor of HPV-related tonsil cancer. And I am known among many within the head and neck cancer advocacy community as Superman HPV. I'm not an arrogant guy or jerk who thinks he's actually Superman, but my friends called me Superman during chemo and radiation. So I adopted the name and went public to hopefully draw attention to a diagnosis I had never heard of. And you all can see my screen, correct? I believe so.
Yeah.
You can see it. Before I begin, I also want to thank Global Action on Men's Health and No Man for inviting me here to speak today. It's really important to me that when I share my story, that hopefully it saves lives. The hell that my family went through back in 2014 can be eliminated, where boys and girls 9 and older can be protected from HPV preventable cancers. And I will tell you up front, before I share my story, I truly never heard of this diagnosis. And so I think it's incredibly important that people understand that the HPV vaccine is for boys and girls, not just girls, and that it can protect future generations from preventable cancer. I know for a fact that had the vaccine been around when I was a young boy, that my parents would have definitely given it to me, and I would have likely never been diagnosed with cancer. People have asked me over the years, and I've been sharing my story for probably 9 years, and every time I go to share it, I get incredibly nervous because I know that hopefully it will have the impact to save lives and impact just one family out there. But people have asked me for years why I wasn't ashamed or embarrassed due to the stigma of HPV. And honestly, when I first got diagnosed, I knew a little bit about HPV and cervical cancer. I never heard of this cancer. So I did my homework and I realized that 3 out of 4 adults by 30 have the virus. 3 out of 4 adults by 30, 62% of freshmen in college. And then I even learned over the last few years that in the last 48 months, tongue, throat, and tonsil cancer, known as oropharyngeal cancer, has surpassed cervical cancer and become an epidemic among men between the ages of 40 and 60, while also impacting women. So again, I hope you'll pay attention today. I hope what I share adds value and that you share my story with friends, family, colleagues. Let me move on to my family real quickly here. So people ask, who is Superman HPV? Where did I come from? Back in 2014, my boy-girl twins were 12. My younger son was 6. I've been married 17 years and life was hectic, right? I was working, traveling all over the country, running to kids' sports. And all of a sudden I was taking a financial exam with my family, put my hand on my face to ponder a question, moved my hand down to my neck. And back then I had hair and no beard. I shaved my head, grew a beard during COVID to see what it looked like, kept it. But I felt that bump on my neck. And so I will tell you, one of the most important things I hope you get from today is if a bump appears on your neck out of nowhere, or you have an open sore in your mouth that's not healing, or some type of awkward feeling in your throat, I would immediately go to your ear, nose, and throat doctor. Too many people take years to get to their ENT or ear, nose, and throat. And this could be discovered earlier and handled more quickly for a better outcome. So I felt that bump. After the test, I went and saw my father, who's a doctor. I said, "What is this?" He said, "Let's call the ENT," which we did. He said, "Jason, you don't smoke, you don't drink heavily. Come see me in a few weeks." This was a Thursday. I immediately went and saw him that Monday, because I'm a guy that goes to the doctor, and you should consider that. It's equally as manly to go to the doctor quickly. He said, "It looks like it could be nothing, excuse me. Let's put you on 10 days of antibiotics and steroids. And if nothing changes, we'll immediately schedule you for a needle biopsy and CAT scan," which they did. I flew that Wednesday, 2 days later, to the Florida Keys, where I ran the equivalent of a 5K. That Sunday, flew to Washington, D.C. to lobby on Capitol Hill. A few days later, flew home. It was a Wednesday evening. I flew home. Thursday had a CAT scan. Friday had a needle biopsy. And Monday found out I had stage 4 HPV-related tonsil cancer. Let me explain to you. Cancer was something that other people got that diagnosis. It was not me. It was for just other people had it. I couldn't believe it. I felt as healthy as I'd ever felt. The only thing that was out of place was that one bump on my neck that appeared out of nowhere. It was devastating to me. All I kept thinking about was who's going to take care of my wife and kids. On the way home from the doctor's office, I called my insurance advisor, my life insurance guy, and I said, "Make sure my policies are on automatic draft. I just got diagnosed with cancer. I need to make sure someone takes care of my family, that they're okay." I called my radiation oncologist friend and said, "It looks like I'm becoming your patient." He said, "What are you talking about?" I said, "I just got diagnosed with a cancer I've literally never heard of." I was so scared. And my doctor told me that I was going to need a radical tonsillectomy, which I had, a neck dissection, which I had. I have a scar that runs from the bottom of my right ear to the center of my throat, 42 lymph nodes removed. And then I had 7 weeks of chemo, radiation, and a feeding tube. This is me with my head clipped onto a table, which I did for 7 weeks, once a week. My friend next to me is where I was having chemo, which was every Thursday for 6 hours. That scar was after my surgery. I was so scared a few weeks in that I made videos to my 3 kids saying goodbye. My videos went something like this: "One day you're going to get married. I'm not going to be there. This is what's important." And I made those videos over and over and over again, because I wanted them to be perfect in the event that I didn't survive, and this was the only thing my kids had to remember me by. And I'm sorry I'm getting choked up. I will tell you that I've shared my story a million times, and every time I share it, it reminds me back to that day sitting on the couch making those videos. It was really heart-wrenching. It was scary having my head clipped onto a table, and by sharing my story, my hope is that you too will have your kids go find out about the HPV vaccine. I was going to say, I'm not a doctor, so I don't tell people to get vaccinated, but go to your kid's pediatrician. This vaccine can protect them from everything I'm describing today. I was in bed 18 hours a day for a month. I had open sores in my mouth and throat. I had 3rd-degree burns, mouth and throat. Every time I swallowed, it felt like there were shards of glass, and it was debilitating. After finishing treatment and towards the end, my saliva became so thick that I would go to sleep at night, and within minutes, it felt like someone was choking me because the saliva had covered my airway. I will tell you that when I finished treatment, I rang the bell August 11th, 2014. It was one of the best days that I imagined. But then 2 weeks later, radiation's the gift that keeps on giving. And every day it was like burn on top of burn. I started to heal. And what I want you to hear is that within a few months, I was back to working, traveling, exercising. But today, while many people tell me that I look fairly good for having gone through what I went through, today, if I were to eat a brownie, floss my teeth, brush my teeth, gargle with mouthwash, I would still spit out chocolate because I have scar tissue in my throat. I still worry that my cancer could come back. I worry that one day my teeth will fall out, my scars, like my neck won't move as well. And I just worry. And the reason I share that with you is not to scare you, but to tell you you have the ability to protect your sons and your daughters, your grandchildren, your children from ever having to worry about this by learning more about the HPV vaccine, which is, again, gender neutral vaccination for boys and girls 9 and older. I want to end on this. Like I said at the beginning, had the vaccine been around when I was a young boy, I know my parents would have given it to me, and I would have likely never been diagnosed with cancer. You have the ability to do this for the people you love, and I really hope you will learn more about it, and you will speak to your doctors, and you will learn more and understand that this HPV vaccination is cancer prevention, and it is available for all of us to protect the people we love. So again, I'm going to end on that. Thank you so much for listening to my story today. I hope I stayed within my time limit, and I really appreciate you, and reach out anytime to me. So thanks again.
Thank you very much, Jason. That's an incredibly powerful statement of the case for vaccinating boys and girls. You couldn't have made it any clearer than you did through your personal experience. So thank you. And I was expecting you at the start to pull back your shirt and reveal your Superman outfit, but maybe another time. But
I thought that would be too much.
Yeah, thank you very much indeed. And let's move on to who I think is going to be our final speaker. I'm so sorry that we can't bring you Samuel from South Africa, but as I said at the start, there's an issue with his internet connection in the area that he lives in, and he's unable to join us. What we'll try and do is record a separate interview with him about his experience and share that alongside the video of this webinar. So hopefully you'll all get a chance to hear what he has to say. But I'm also very pleased to welcome Kevin Case, who's joining us also from the States, in the Cape Cod area, I think. Kevin, you're very welcome, and please tell us your story.
Thank you, Peter. Hello, my name is Kevin Case. I would like to thank the previous speakers. You are very courageous. And to the organizer for having this event. I come to you from Cape Cod. At this time last year, I was halfway through a 6-week course of chemotherapy and radiation for an STI disease that I, as a 59-year-old HIV negative, queer, sober man, had never heard of affecting men, the human papillomavirus. I'm glad I was diligent in seeking medical attention after waking up one day with a pain in my anus. Otherwise, I had no symptoms. The surgeon who did the initial exam confirmed the biopsy to have HPV 16. I had stage 3 anal cancer caused by HPV. The discomfort I was experiencing was from a sizable tumor. What next? So I had the C word. Mind you, I went to my doctor every year, had prostate exams, was up on my colonoscopies and my STI testing. Nothing was ever spoken about HPV. But a friend of mine told me that if he were diagnosed with cancer, that he would want me to advocate for them, and now I had to advocate for myself. And another friend said to me it was my obligation to go out, find information, to help myself, and then to share it with others. And in that, I found a community of people who could assist me. I know that being vulnerable is a strength. I learned that people between the ages of 9 and 26 are eligible to be vaccinated for HPV. I was out of that age bracket when I was younger. But male vaccinations and HPV testing are not standard protocols. This needs to change. In my research, I found out about the anal pap smear, a screening tool. And no, it didn't hurt, a bit uncomfortable, but remember, I was determined to save my own life. The pap smear confirmed again I had been infected with the HPV 16 virus, one of the strains that cause cancer. While a real bummer, I'm glad I got the test. My mind searched where and how I had gotten infected, and soon I had to just let the questioning, the fear, and the shame go. Time to move on to the here and now. More education and self-advocacy were in order. I also learned that I was not alone. It is my opinion that the HPV vaccination and testing be required. I chose the NIGRO protocol, which resonated more to me than the first treatment option. Treatment was brutal, but necessary. There are newer treatments available and more are being researched. I have many friends around me and supports, and I said to them, we're going to stay positive and keep my dark sense of humor. If they wanted to offer helpful things, I would need walking partners, rides to the beach, and ice cream, which it went swimmingly for me living on Cape Cod. I learned to chant to stay calm and kind. I continued journaling and composed a photo and video journal of my treatments to keep living a focus. I read Dr. Bernie Siegel books, along with many audiobooks, to keep myself entertained. I was gifted a nutritionist who was amazing and always said, food is medicine to heal, you need to eat. And as a chef, I know that to be true. I also needed to keep with my physical plans to walk and stay fit and stay hydrated. My life's mantra up until then, I won't ask for help unless my ass is on fire. Well, my ass was on fire and I needed to ask for help. I had an oncology social worker that turned out to access services I did not even know existed. Brava, Judy. My care teams were outstanding and supportive to me, especially when I got harried and wanted to quit. I didn't quit, or I just continued to keep asking questions. They answered them for me. So, to date, I am NED, no evidence of disease. I am now under observation every 3 months by the second surgeon. The doctor was real, compassionate, and direct, especially when I needed to be told that my treatment could not wait until the high season was over because as a pastry chef, I needed to work. They kindly said to me, Kevin, your cancer is aggressive. It needs to be treated aggressively, and you are now your own full-time job. So as a man living post-HPV cancer, I find it important to be physical and mental health accurate. Self-compassion and pelvic floor treatment is imperative for healing. Psychotherapy, medication, if needed. Support groups are very important. So the online group that I participate in is called Cheeky Charity. It's for the LGBTQIA community, people with anal cancer, colorectal cancer, and it's a great resource for people. I also contacted the HPV and Anal Cancer Foundation and got a peer thriver, which was very instrumental in keeping me going and helping me. I continue to petition for male support groups for cancer here where I live. And I feel it is imperative that HPV screening needs to be included in STI treatments. And don't be shy about asking for sexual health care. No discussion is off limits. And the experience has given me a voice, not only to speak today, but to let people be aware of the HPV. Subsequently, I became a certified community health worker. And I would be derelict if I was not to mention Henrietta Lacks, who without her immortal cells, the HPV virus would not have been discovered. Her cells are my backdrop. They are quite beautiful. So in closing, I would like to say HPV and HPV-related cancers, its stigma and shame need to be abolished. This can only be done when we surrender our pride and ego. So, won't you save your own ass? Drop your trousers and get an anal pap smear? You could save your own life. Thank you again. My name is Kevin. I did not do this alone. I'm alive. and glad so are you. Thank you.
Thank you very much, Kevin, for sharing your story so eloquently. And I'm so pleased that you raised the issue of the importance of psychosocial support for men who are going through anal cancer, or indeed any of the cancers that we're talking about today. And also that you raised the issue of screening for anal cancer. As I'm sure people will know, there are no organised screening programs for any of the cancers which occur in men caused by HPV, but the one we're closest to is for anal cancer. So it's a really important issue, which we may well come back to. So thank you for that. Please do share your stories. Please do share your questions and comments in the chat box or in the Q&A box. We've had a few which I'd like to come to. There was one from Ian Pete asking about what we as what healthcare providers can do to better support men with penile, head and neck and anal cancer. So I think Patrick's in the process of actually typing an answer to that question. But Patrick, would you like to actually share what you're typing so we can all hear that?
Hang on, I'm unmuted now. I'm back online. So I was just typing something in an absolute nutshell. I mean, to encourage whomever it may be in the people that run GP training, and I know it's extensive, but to at least cover these HPV-related cancers and male cancers, so that when doctors encounter them in their surgeries, they have an awareness of them and can, I don't know, point people in the right direction. I mean, I've heard so many stories of people that were misdiagnosed, sent down the sexual health route or this route or that route, and that many, many months later, by the time they're actually diagnosed, you know, often the outcomes are much more tragic than they should have been. And obviously, it goes without saying to do whatever they can to promote the use of the gender neutral vaccine to everyone, and to make the awareness of it much more prevalent.
Thank you. And it sounds from the experience you talked about earlier that you were fortunate that your own GP recognised that your own symptom of penile cancer was actually much more serious than you assumed it was, or that many doctors might think at first sight.
Yeah, no, absolutely. And I hadn't realised. I mean, I've done some stuff with Orchid, and I think Sinead's on the call from Orchid, and the number of stories that I've heard through them from other men with penile cancer and other male cancers that were misdiagnosed is scandalous, really. And I didn't even know it was a thing, and so afterwards, when I realised how frequently it's misdiagnosed, I actually contacted my GP and asked her if she had had any specific training in that matter. Was that why I was so lucky? And she said no, but she hadn't had any specific training, but she was just aware of it and diligent, shall we say. So I was fortunate. I could have seen, another GP in that surgery on that day, and the outcome could have been very, very different.
Yeah, thank you, Patrick. Jason, this is such an important issue. Do you have any thoughts about what healthcare providers can do better in terms of supporting men with the cancers that we're talking about?
Yes, and can I also make a point that I'd like to have made earlier, just to get it out there so I don't forget to say it?
Go ahead.
I will do that quickly. What I wanted to say, I should have said earlier, is that they believe that through oral sex with a woman when I was 18 or 19 in college, that I was exposed to the virus. Most people know that when 100 people get exposed, let's just say 99% of the body fights off the virus. They never knew they had it. But the 1% like me, the virus can lay dormant in the crypts of the throat for decades. My father's best friend was diagnosed at 73 after 50 years of marriage. And again, one other thing is that my wife, I've been married now 28 years. My wife has never tested positive. And so I want to mention this to you because I think I speak to probably 2 to 4 cancer patients, survivors, caregivers a week. And a lot of times it's a spouse that says, they think they got it from their spouse, or vice versa. And the answer is, my spouse has never tested positive in 28 years, and they think I was diagnosed or I was exposed decades ago. So I wanted to get that out there to, just make sure people have that information. Regarding,
I'll sorry, Jason, to interrupt, but there's another point there. I think that what can often cause an issue is that the spouse might think that the diagnosed partner has had an affair and picked up HPV from a recent affair, rather than
Correct.
understanding that this may have been picked up 30 years ago before the couple actually met. And that's, I think, an important issue that physicians need to discuss with their patients, so there's no misunderstanding.
Really important, right? Because I literally have this discussion every few weeks with somebody throughout the world about that. And then you were asking about how doctors can best speak to patients about.
Yeah, please. Yeah.
So one, remember, like I said earlier, if you end up with a bump on the side of your neck that appears out of nowhere, open sore in the mouth, go see your ENT, your ear, nose, and throat doctor, because that's something I deal with all the time as well. And men don't have the information to know this could be a problem, right? They think it's a cold sore that will eventually go away, and 6 to 12 months later, they're then addressing an issue that could have been addressed significantly earlier. I think the idea that just people understanding about HPV, I mean, I'm a guy that was my dad's a doctor, and when I heard this diagnosis, I literally never heard of it. So I think just general information regarding this is what HPV is, this is how prevalent it is, this is how common it is, you've done nothing wrong, this is something you should be on the lookout for. And then knowing that if it's caught early, it's oftentimes treatable, right? Where you can survive and thrive. And so I think just the overall openness to have the discussion that you've done nothing wrong, like was said earlier.
You've got on mute, Jason.
Sorry about that. I hit my mouse for a second. I just need men to understand that are watching this, that there's nothing embarrassing, nothing that you should be, ashamed for if you end up with this diagnosis. It is so common. And I think that message needs to be communicated better by physicians. So men specifically, all people, but men specifically, are open to discussing it. And I think that's the issue. I don't think most people understand 3 out of 4 adults by 30 have this virus. So did I address your question, or did I not?
I think so.
Your question?
Yeah, you did. Thank you very much. And Kevin, is there anything you'd like to add about what you think that healthcare providers could do better for men in this situation?
I believe that healthcare providers need to be informed of the HPV virus and also proactively test for them. It took me 6 months and a couple of doctor's appointments to even find a diagnostic surgeon. And like I said in my story, in the interim, I had an anal pap smear. And the nurse practitioner, she apologized for taking so long to come into the appointment because she was researching how to do a male pap smear. She said she had never done one. And I said, well, I've never had one. So then we're going to both learn together. And so I think it's important, regardless of the demographic or social class of the person, screening is very imperative. And like I said, I had the same doctor for about 18 years. Never once did we discuss HPV. I also educated them in a few other items as a queer man, which is fine because I feel it's important that peer training also happen. But doctors need to be more well educated and informed about viruses, especially one that's exploding in an age demographic like ours, and men in particular, because men don't say anything until it's too late. So
Can I add one thing to that? And even though I'm the throat cancer survivor, I've learned a lot about HPV related anal cancer through being highly involved with the HPV Cancers Alliance here in the US, and I'm on the board of the Head and Neck Cancer Alliance. But when I go to my urologist and they do the blood test for your PSA to know whether or not it's high or low due to prostate issues, a few times they have said that they weren't going to do the digital rectal exam. And I said to them, I know a dozen people who detected HPV-related anal cancer because of the digital rectal exam. I'd like you to do it.
Yeah.
And so I think that is a good message. Unless it's just something here in the US, I know that sometimes they will say, no, your PSA is good, we don't need to do that. And I would recommend people always get it done, because you might be able to feel something that doesn't appear in the PSA tests.
Yeah.
And so I just wanted to throw that out there.
Yeah, I actually, like I said in my story, I demand that I have a digital exam every year. So my cancer, my tumor, literally showed up and presented within a year's time. Very aggressive. And in my research, I understood that you can have transmission of HPV virus from vaginal to a baby in the birthing canal, and it does live dormantly, and life circumstances will trigger it, and it's being proactive and informed, regardless of your gender. I think is the most important part.
Thank you very much. And there's one other point I'd like to add, if I can sort of take chair's advantage here, that a key role for healthcare providers is actually talking to parents and young people about the importance of vaccination, because in many countries there's a lot of skepticism about the safety of the vaccine, false stories about the vaccine causing infertility, for example, or encouraging people to have sex at a very early age. There's people don't understand the case for vaccinating boys very often, although they may understand it for girls. So healthcare professionals have a really important role in communicating clear evidence-based information to parents and young people to encourage the take-up of vaccination. And there's a real need for better medical education and better training for healthcare professionals in the field of vaccination generally, but HPV vaccination in particular. Can I ask a question to all three of you again about the stigma? Because this is obviously a key issue about dealing with the stigma, because we're talking about a cancer which is as a result of an infection caused by a virus that is sexually transmitted. And there is a stigma attached to this, and also the parts of the body that are affected are difficult to talk about for many people. So how have you got to a place where you're able to talk about this issue so openly? How have you dealt with the stigma, or is the stigma still an issue for you? Patrick, could I perhaps come to you first on this one?
Yeah, I mean, it's a good point, and I think, I mean, I have thought about this many times, and I'm happy to talk about it. Most people aren't happy to talk about cancer, as I mentioned. Most people aren't happy to talk about any issue with any, should we say, intimate part of their body, generally speaking. And I think, that's, sadly, probably a human being aspect. We are human beings with private moments, private areas, and, they're not for public consumption. Whether that's a human thing or a societal thing, that's probably a bigger question than I can answer. But I just think, unless we do something about it, and as Jason so rightly said, this is cancer prevention and cancer cure in a needle. And I think it's a scandal, frankly, that it isn't A, widely known about, and B, widely adopted around the world. So it is difficult, to answer your question, to talk about it. Many people won't, and I'm happy to do so, even though I know when I do, if I'm in the company of friends, I can see them trying not to, but definitely squirming when I talk. Oddly enough, very few of my male friends actually ask me any detailed questions about it. It's usually their wives, interestingly enough. And I think, well, if no one else is going to do it, then, I need to.
Okay, thanks. Kevin, how have you dealt with the stigma issue?
I think once I got over the shame and what I felt other people were going to say about me, I just carried on. If anybody I knew talked to me, and I was going through treatments, and I would say to them, you really need to be checked for HPV in general, because in my community, STIs are somewhat prevalent, but nobody tests for the HPV virus. And so letting go of the shame and being able to discuss it. And a few of my friends actually proactively went out and got tested and were grateful to me that they did, because one of them is, now being watched for cancer cells that may or may not mutate. And others came back negative. So I think speaking about it freely, like Patrick said, if you squirm in your seat, it's perfectly fine with me. I'm there to give you whatever information you need. And when I disclose to people, I had HPV anal cancer, for me, it empowers me, because there's such a taboo, not just for men, but women in general too. So opening the world to any discussion is very important. And that's what I've learned. There are no limits to what you can discuss.
Thank
So
you.
that's
Jason, same question to you.
Yeah, I want to add one thing because I've seen some comments about it. People always wonder, HPV related anal cancer, does that mean you had anal sex? And I think when people become better educated that no, you didn't have to have anal sex to end up with anal cancer. It's just cancer, like another cancer caused by HPV. I think education is really critical. And secondly, when I realized, and I sound like a broken record probably, but when I realized that 3 out of 4 adults by 30 had this virus, I thought, why would I ever be ashamed or embarrassed about a virus that most people have? And I love, like, as much as possible, my wife and kids. And I thought, what, if I can protect other people, other families from going through the hell that my family went through, I'm sharing out, not worrying about anyone else, and figuring if I even just help one family, I've done my job. And so I think understanding and education about what it is and how many people have it will help eliminate the stigma.
Thank you. You make a very important point about how common HPV infection is. And we know there was a study published a year or two ago which showed that worldwide, about 1 in 5 men at any one time has a high risk cancer-causing HPV infection. So it's an infection that's difficult to avoid, in fact, for many of us. An interesting question's come up from Damien Naidoo about prostate cancer being linked to HPV, and this was actually addressed to you, Patrick, but I'm not sure if you would have an answer to. I doubt if your prostate cancer was linked to HPV, but it's an interesting area. Do you have any comments on that?
When I was diagnosed with my penile cancer, I contacted my prostate cancer surgeon because I'd moved from Brighton to Liverpool in between times. And because obviously I was in shock. Like I said, I had no idea that penile cancer was a thing and HPV. And I messaged him and I said, I've now got penile cancer. It's only a few years later. Is there any link? Is this something that could have been potentially foreseen? And he wrote back and said, no, that it was wholly unrelated. But I have since discovered, partly through you, Peter, that there has been some research, and you'll know more about this than me, that suggests that some, I don't know about some or all HPV cancer, prostate cancers, there is potentially a link of in HPV to prostate cancer as well. And to be honest, it wouldn't surprise me. But I don't know. I'm no expert.
Well, I don't think any of us does, but there are several papers, you quite rightly say, that have suggested there could be a link between HPV and prostate cancer. And obviously, we're facing a vast explosion in the number of prostate cancer cases over the next 20 or 30 years worldwide. And if HPV is discovered to be a factor, even if it only cause some of those cases, that would make the vaccination of boys worldwide, it would happen probably tomorrow if we found the connection there. But maybe I'm being a bit optimistic, but that could be a really significant development.
I think it could be. And I mean, who knows is the answer, but it genuinely wouldn't surprise me.
Okay, thank you. And we've perhaps got time for, I'm just looking through the questions. I'm afraid we can't answer all of them. We've got one question from Bruno Mendez. Do we have any studies showing how any potential benefit to receive the vaccination even after being 45 years old. Well, as far as I'm aware, the vaccine is not licensed for use for people over 45, but certainly for adults under 45, there may well be some benefit. And there is now a debate opening up about adult HPV vaccination. Many countries at the moment vaccinate up to 26 for girls often, and sometimes for boys, young men. But for that group between about mid-20s and 45, there is a case for vaccination because even though people may well have been infected with some HPV types, they may not have been infected with all of them. So the vaccine can offer some protection there. It still can be useful. And I just wanted to pick up one other point because it's come up a few times about screening for anal cancer. And David Winterflood, I wonder if I could bring you in here because this is an area which I know you have some special insight. So do you want to say something about where we are with anal cancer screening and the likelihood of being introduced more widely?
Yeah, I mean, we obviously had a great breakthrough with the Anchor trial a couple of years ago in the United States and the use of high risk anoscopies. So there's certainly guidelines that have been published in recent years by International Anal Neoplasia Society. I believe some governments now have published guidelines around screening for higher risk populations. So in females, if for people for females, if they've previously had a cervical cancer or a vaginal or vulval cancer, then they would be at higher risk of developing an anal cancer. I think one of the points I make, which goes back to the point which Jason and Kevin were making around the digital rectal exam, is that quite often in the case of anal cancer patients, anal cancer is often misdiagnosed as hemorrhoids. And actually, we find there is a scenario whereby patients often have to speak to their medical professional a couple of times before those symptoms are checked out in greater depth, i.e. through a digital rectal exam. And it's something perhaps on the back of COVID and more triaging being done digitally or less in person, as it were, some of that more hands-on care, so to speak. Anecdotally, we see that seems to have been diminished. So whilst we have these screening guidelines, actually it's getting people diagnosed in the first place. So it's certainly encouraging. As to whether there will be national guidelines for the whole population, anal cancer is a rarer cancer. So it all comes back to, whilst these screening opportunities are very encouraging, the best thing we can do is vaccinate both boys and girls to prevent them from getting any of these cancers in the first place.
Thank you, David. That's a great place to finish on. I just want to say a few final words and tell you about our forthcoming activities. If you want to follow the work that we're doing at Global Action on Men's Health and No Man is an Island on men cancer and HPV, then please sign up to our quarterly newsletter. It's free, and we'd be delighted to send it to you as and when it becomes available. And there's a URL there that you can go to, but I'll come back to that if you haven't had a chance to write it down. And these are some of our other activities for the rest of 2025. So we're starting work on a joint academic statement on men cancer and HPV. We've got a group of experts together to produce what we hope will be a definitive position statement, making the case for gender-neutral vaccination and addressing some of the policy barriers currently facing us when it comes to achieving global gender-neutral vaccination. We're going to, starting at the IPVS conference in Bangkok in October, we're going to discuss launching a regional initiative in Asia on gender-neutral vaccination. And if you're in the Asian region and you'd like to be involved in that or find out more, please let us know. If your organization hasn't already endorsed our global call to action, please take a look at endhpvglobal.org and contact us if you'd like to find out more and perhaps hopefully sign up your organization to support the campaign. We're going to continue our advocacy work to try and make sure that as many countries as possible vaccinate boys and girls, and to achieve our target of global gender neutral vaccination by 2030. And also as part of that, we are trying to build a coalition of governments who support gender neutral vaccination. What we'd like to do is to work with governments to put more pressure on the WHO to change its policy on vaccination, HPV vaccination. So if you're here from a government and you'd like to talk to us about that, please do get in touch. And there will be further webinars this year. We're planning 4 more by December, and you can find out more from the newsletter. We want to carry on with this work, working with men with lived experience of an HPV cancer. We're interested in setting up an advisory group, and we want to talk to that group look to them for advice and information about how we can work with HPV cancer survivors as part of our campaign. So please do contact us and help us break the stigma attached to these cancers. We'd love you to evaluate this webinar. So please go to use this QR code to go to our very quick evaluation form. It will take you only a few minutes to answer, but it's very important to us and enables us to improve our webinars for next time. So I'll just give you a few seconds. Okay, we have moved on. So read our report. There's a QR code linking to the report that we published, which underpins our campaign. And finally, I'd like to thank once again Patrick, Jason, and Kevin for sharing their fantastic stories with us so openly. Thank you very much indeed for your kind and generous support. Thank you to Tim Shand for working behind the scenes to make this webinar possible and to organize it so efficiently. And thank you to everybody who's joined us. And I hope you found it an interesting discussion. And please do keep in touch. We're building a global campaign here and we need as much support as possible. So thank you, everybody, and goodbye.
Thank you.
Everyone.
Thanks, everyone.
Take care.
Thank you very much, everyone. Happy to help.
Thank you. We'll be in touch. Thank you. Thank you very much indeed, everybody.